Kaduna is a large cosmopolitan city in north-central Nigeria. The population of the city, according to the 2006 census, was 1,139,578. With a population growth rate of 2.53%, this figure is projected to reach 2,360,000 by 2025.
Over 60 to 65% of the people that we have in Kaduna State are under the age of 35. Now that has a lot of implications, both in terms of jobs, in terms of security, in terms of healthcare and education that we provide for our people. In clear terms, if we are able to reduce the rate of population growth of Kaduna State from our own calculations, it results to a 22% rise in GDP for the state. Because we will not have to spend as much as we are currently doing now. Now, this is a message that we need to sharpen and communicate.
Nigerian Urban Reproductive Health Initiative, NURHI, a Bill and Melinda Gates-funded project, was introduced in 2009 to support the provision of family planning services among the urban poor. It initially focused on 4 Nigerian cities: FCT Abuja, Ibadan, Ilorin, Kaduna, but was scaled up to Zaria and Benin City in 2013 and then Lagos in 2016. In 2011, NURHI conducted baseline research of fertility indices in Kaduna metropolis, which revealed contraceptive prevalence rate (CPR) of 16.3%, unmet need for family planning 26%, married women not using any contraceptive method 73%.
Family planning was not prioritized intervention. At policy, institutional and community levels, people held views about family planning that inhibits investment and uptake. Family planning was therefore poorly resourced. This is in terms of funding, in terms of human resource capacity, and density of facilities able to provide full range of the services were also limited. Commodity and logistics management system was based on cost recovery. Even at that, it was priced out of the range of the poor. There was, in effect, a conspiracy of silence. As such, family planning was an offhand program embedded within the RH intervention.
NURHI's strategy was to create demand for family planning services through social mobilization and mass communication, create a favorable climate for family planning through advocacy to policymakers and to political, religious, and community leaders. Improve the quality of family planning service delivery through facility improvement and training of personnel. Integrate family planning into maternal and child care services. One of the first challenges NURHI faced in Kaduna was the widespread misconception about family planning.
And I was one of those who told them, look, in this part of the country, the northwestern zone of this country, there is need for you to realize that approach depends on your choice of words and language. This was what prompted, I believe, the choice of childbirth spacing instead of the word family planning.
When child spacing came in, most of the people are running away from it. They felt that it's not a child spacing issue, that is totally stoppage of giving birth. That is why most of the women are afraid to go into the family planning activity.
It's something that really people need, but nobody wanted to talk about it then because people hide under religion to say that if you discuss about family planning, it's as if you are going against the religion's teaching.
Securing the support of religious leaders was the turning point for the intervention in Kaduna State, particularly when we did our roundtable discussion on galvanizing religious and traditional leaders' support for childbirth spacing. That was key. Everything else we know in terms of intervention programming fell into place once we secured the support of religious and traditional leaders.
NURHI set up an interfaith forum to eliminate the misconception that religion was opposed to childbirth spacing. This gave Muslim and Christian religious leaders a platform to address and publicly support issues of childbirth spacing.
Child spacing, like we said, and religion, they are together. There's no controversy. There's no controversy. That's why we are, we are trying day in, day out to eliminate those misunderstandings, misconceptions.
Allahu Akbar. Dan Allah ba ma tausaya wa matanmu. Idan har mun ce a sami yara su tare da yawa don ka haifu da yawa. Tunda manyan malamanmu sai da aka zauna tare da su ta. Assalamu alaikum.
Even though God has asked us to go and multiply and fill the earth, the same God has also said that if someone is not able to take care of his family, he's worse than an infidel. In other words, it is in the plans of God that you give birth to children based on the number you can cater for, and also to keep those who are producing the children, I'm talking about the mother now, to be healthy.
To ensure widespread and visible support for childbirth spacing services, NURHI set up an advocacy core group to interface with political office holders, policymakers, stakeholders, as well as traditional and religious leaders. This helped to create a more favorable climate for childbirth spacing in Kaduna.
We were called ACG, Advocacy Core Group. And I knew that time, we went to every person that actually will give us that support, will understand what family planning is all about. And we had many visitations to the Emir of Zazzau, and we got his backing. That is the traditional institutions. And then we also went to the imams and the pastors. We went to government house.
Prior to 2012, there is no specific policy stand on the creation of a budget line for family planning. As a result of the close collaboration between the Ministry for Local Government and NURHI, after a series of discussions and advocacy, the ministry found it necessary to create a budget line for family planning across all the 23 local governments in the state. So the budget line was created in 2012 budget. Each local government was given 500,000 naira.
In this 2018 budget, we were able to also get 75 million from the very same administration, and we hope to get 75 million for the 2019 budget.
In 2018, we were able to make procurement of family planning consumables, not commodities. And but in 2019, because we have seen that we have gap in the supply from the national, so we intend to use the 70% of the 120 million to procure commodities and use 30% of it to procure consumables.
NURHI used media to take the message of childbirth spacing across Kaduna metropolis. It designed and aired a radio drama serial in Hausa called Komini Sanjiva, which had live phone-ins. The drama was to inform, educate, and generate discussions on childbirth spacing.
We had Interfaith Forum champions who made appearances on the radio drama magazine program. We also had Interfaith Forum champions who also made radio and TV appearances during high point days like World Health Day and International Women's Day.
In order to achieve better spousal communication through greater male engagement and childbirth spacing issues, NURHI created a radio program targeted at men.
The platform that we engaged was the National Youth Service Corps. The work we did with them was to support them in creating a segment to that program, which was tagged Go Mengo, and that segment particularly focused on family planning content that was directed and formatted for the purpose of engaging with men and for the purpose of getting men to take a leadership role.
Hello people, it's a beautiful day in Kaduna State and we're airing from Supreme FM 96.1 and you're on to the Go Mango program.
To reach the TV viewing audience in Kaduna, NURHI placed Get It Together adverts promoting childbirth spacing on local television.
Get it together domin ingantacciyar rayuwa.
NURHI also found innovative ways to reach people with Newman Street, a TV series promoting childbirth spacing. The percentage of women exposed to NURHI 2 supported mass media were 67% more likely to report discussions of childbirth spacing with their spouses. Women also exposed to NURHI 2 childbirth spacing information were about 4 times more likely to report partner support for childbirth spacing. NURHI embarked on social mobilization and outreaches to create demand for childbirth spacing services in communities.
The family planning, the way we explain it to them, we re-educate both the male and the female, although it takes us time before we convince them. Some of them don't even know. If you go to them, they will tell you they don't want to do it because they feel maybe there is side effect. So we later understand that it is fear that makes most of them do not even come close even to the hospital. But when we break the news to layman understand it to them, they get the full information. After 2 or 3 people, the turn-up of the people were now much.
Overall, NURHI conducted 2,832 social mobilization events in Kaduna between October 2015 and March 2019. There were 154 social mobilization events in Year 1, 1,042 events in Year 2, 1,208 in Year 3, and 428 in Year 4.
Immediately after the introduction of the outreaches across all sites in Kaduna, the statistics are climbing. People became aware of the services in each facility and subsequently were able to access those services there, and they were telling others.
A total of 578,167 people were referred from NURHI social mobilization activities to NURHI supported facilities in Kaduna. In Year 1, of the 18,244 referrals, 5,613 of them, or 30.8%, accepted childbirth spacing services. In Year 2, out of 115,187 referrals, 51,728 or 44.9% of them accepted childbirth spacing services. In Year 3, there were 117,930 referrals and 68,372 or 57.9% accepted childbirth spacing services. In Year 4, out of 45,838 referrals, 23,873 or 52.1% accepted childbirth spacing services. NURHI embarked on facility improvement through renovation, provision of equipment, and training of childbirth spacing providers.
The 72-hour clinic makeover is basically a facility improvement process that looks at every single thing within the service environment that needs to be changed within 72 hours during off-work period, starting from Friday evening and then opening up business on Monday morning with a brand new facility, brand new equipment, everything glittering, and then a commissioning.
Thanks to NURHI, we are now doing well. As you can see, the unit is well renovated and there is adequate supply of instruments, equipment, consumables, and varieties of family planning methods.
From the sustainability effort of NURHI, so we were able to access for funds from Saving 1 Million Lives in January 2018 to train about 177 service providers in tax shifting, tax sharing.
With the training that NURHI started and is still ongoing, you find that the attitude of healthcare providers has changed positively. We now are able to provide the services from a more well-informed position. And so we're able to create and generate confidence in our clients who actually turn out to be advocates for the whole program, and they tend to bring in more women to access the care.
Apart from the fact that we have a family planning clinic, but we are seizing every opportunity to introduce family planning services at PMTCT. When we are offering PMTCT services at our facilities, family planning was integrated into that. ANC, family planning was integrated into that. And even at child welfare clinic, where mothers bring their children for immunization, we try to integrate family planning into it.
I think the foundation for the next decade and more is already here with us in terms of the programming capacity and investment. Demand will continue to rise. Investment in family planning will continue to grow. I also see family planning, a situation where family planning will be seen more and more as a development and security priority rather than just a health issue.
NURHI has done excellently well, as acknowledged globally, by demonstrating to us so clearly a concept that has worked and changed the landscape of family planning in our state in particular and the country in general. The challenge now remains ours to provide the needed scale and prominence for family planning services in our health programs.
So we're doing quite a lot to support family planning in the state based on what we have found. We have about a 35% unmet need. And some of the measures are, first of all, we have obtained permission from Federal Ministry of Health to buy commodities directly from the state. We're just waiting for the guidelines from the national so that we can commence that process. We have already got budgetary provision for that. We have used the task sharing policy to increase the number of health workers that can provide family planning services. Over 200 CHUs have been trained in how to provide services, and they're across the state. We've increased the number of facilities that are offering family planning services up to 690 at primary healthcare level, and over 1,000 across the state.
NURHI played a very strong role, in child spacing here in Kaduna. The one thing that I don't forget with NURHI is your messaging, and your slogan, "Get it together." I think NURHI, for me, has been the only organization that has used Christian and Islamic religions, getting them to actually come out and talk about family planning. I think getting all of us, to come to the same table to talk about family planning, which usually is not done. So I think I've had quite interesting times with NURHI. They've contributed a lot to how we view, childbirth spacing, not only here in Kaduna, but I think in most of the states where they have really worked.
For whatever success we have been able to achieve here, has been the effort of everyone supporting and pushing the cause of family planning in all tiers of government. Our royal fathers, religious leaders, community leaders, frontline health workers, the media, development partners, and the ordinary beneficiaries, the clients of family planning in Kaduna State. To all of you, we say thank you.